Hello, my name is Emma Smith. I'm a Senior Research and Evaluation Officer from the NSPCC. I'm going to be talking about some research conducted by our Research and Evidence team, which identified the barriers and facilitators affecting the sustainability of NSPCC services which have been scaled up. So by scaling up, we mean our implementation teams will support sites external to the NSPCC, like local authority teams or voluntary agencies, to deliver the service. Part of the NSPCC's strategy is to test its newly developed evidence-based services through robust evaluation. This then informs which services are appropriate to take to scale. This evaluation aimed to revisit 3 services which had been scaled up to see how sustainable they appeared to be between 2 and 4 years after they had first been implemented. We'd already conducted evaluations about their early implementation, but wanted to look about what happens in the medium term. The services involved were Baby Steps, which is a perinatal education programme, Graded Care Profile 2, or GCP2, an assessment tool to support the identification of child neglect, and Domestic Abuse Recovering Together, otherwise known as DOT, a group work programme to support mothers and children who have previously experienced domestic abuse. So this is a qualitative piece of research involving 21 interviews with service or implementation leads from one of those 3 services. So we categorised each site in terms of their level of implementation 2 to 4 years on as either high, medium or low. And this was informed by fixed and stages of implementation, as well as other factors such as the site's own perception of how sustainable they felt they were. Criteria we measured the sites against included having a good level of strategic support and that the service was embedded in policy and practice. The chart displayed on the poster illustrates the number of sites which fell into each category. The facilitators identified from the interviews included having a sound infrastructure with good strategic buy-in and strong champions, especially at strategic levels from early on. The train the trainers model was really key to helping the service sustain itself, which helped to mitigate against staff turnover. Sites that started big by investing a lot in the model early on, for example by rolling it out to a number of teams at once, tended to be doing well. There were also many benefits where different agencies were involved in service delivery, such as helping to maintain staffing and referral levels. Sites who collected and used evaluation and monitoring data effectively, for example using this as evidence to support future funding bids, and enthused practitioners also tended to be doing well. Barriers which appeared to negatively impact on sustainability included staff having a lack of protected time to deliver the service, funding streams which were time limited or considered insecure, a high staff turnover at either the delivery site or the referring agency, and various logistical and practical issues such as finding appropriate venues to deliver the service. In conclusion, there was a mixed picture, but evidence that there were a number of the services had high levels of implementation, were optimistic about the future of the service, and had built-in strategies to help the service be sustained in the longer term. Maintaining the infrastructure, continually promoting the service, and effectively using data and techniques to future-proof the service, such as using the train-the-trainer model, are key. If these things are in place, the service gathers momentum and at a certain point can start to drive itself without the NSPCC.